Hello, my name's Tariq Drabu. I'm a dentist based in Manchester and I am a specialist in oral surgery. I am the staff specialist in oral surgery at the Euclid Dental Clinic in Preston. Today I'm going to take you through the contents and use of a basic oral surgery kit. We're going to look at the instruments involved, their usage, their handling. We're going to cover this in 3 chapters. In Chapter 1, we'll be looking at the instruments required to raise a flap. In Chapter 2, we'll be looking at the instruments required to maintain a flap raised. And in Chapter 3, we're going to look at wound closure and soft tissue management. I think it's very important that all general practices should have an assortment of instruments ready to go that would constitute a basic oral surgery kit. Whether that is formally put together in a metal tray or whether that is grouped together in a simple bag system, it is very important because at any time there could be either emergency oral surgery procedures or pre-planned oral surgery procedures that the practice must take into account. The instruments that I'm using today are manufactured by Hugh Freedy. They're presented in a large autoclavable tray. The tray comes in 3 separate sizes and also has a color coding system. So for example, if you wanted to have an oral surgery kit, you could color that blue, you could color an implantology kit green. So you can keep these stacked and ready for use as and when required. The tray opens up by means of 2 simple clips on the side. And as we open it up, we can see all the instruments that are there. The lid, as you can see, has color coding here on the inside, which can be changed, and also has some little locking mechanisms where you can store instruments such as needle holders or scissors, thus keeping them out of the way of the main tray in here, and also which frees up space. In this chapter, we're going to be looking at flap retraction and maintenance, and the instrument that I'm going to be talking about is the Kaywood Minnesota retractor. This one instrument has a lot of very useful features, and I will take you through them one by one. First of all, this is the working end where my finger is, and this working end is not sharp, so it does not cause trauma to the tissues. So when you are retracting your flap, if by any chance the instrument does slip into the soft tissues, it's rounded, so it will not cause trauma. The second thing I want you to notice is that this instrument has 2 guide rails here. So when you're working with a drill along the long axis of your retractor, if your drill does move again or slip, the first thing that it will hit is the guide rails. So you have a margin of safety with this type of retractor. The third thing is it's very ergonomic. I'm looking down and it has this bend here, so it allows me to look straight into my flap and to my surgical site. The fourth thing is it has a nice round end here, so it can be used for upper flaps or also alternatively as a tongue retractor. So it has many uses as a flap retraction instrument. We're now going to look at the retraction of the flap and the maintenance of that retraction. And the instrument that we're going to be using is the Kaywood Minnesota retractor. Having raised the flap, you slide the Kaywood Minnesota retractor in, with the curved end being the non-working end for a lower flap. So I'm now able to look down the curvature of the Kaywood Minnesota right into my flap with an unobstructed field of view directly into the surgical site. As said before, the 2 guide rails on the Kaywood Minnesota allow for accurate positioning of a surgical drill into the area where we're working and provide a safety margin if the drill does slip, and it allows the facilitation of accurate and careful and judicious bone removal. The double bend there allows the unobstructed field of view into the surgical site, and ergonomically it's lovely to hold with minimal pressure on the wrist and can be moved and rotated very, very simply left to right, up and down. and it's very, very simple to use and very, very effective as an instrument for retraction of the flap. In this second video, we've looked at flap retraction and maintenance, and we have just focused on a very effective instrument, the Kaywood Minnesota retractor. We've gone through all the important points that are relevant to this instrument, and it is a very, very useful instrument in basic oral surgery. As with all instruments, it's important to consider that yes, they are a capital expense, but investing in good, high-quality instruments will ensure that they will last you your practicing lifetime.